and this vlog's about guys over 50, mostly, women over 50. The treatments, the top 5 treatments they usually have to get. So we're going to talk about, what are the top 5?
The most common treatment will be dental crowns. And then the second one will be root canal treatment because you might have some pain otherwise. And then sometimes we cannot save the tooth for you with root canal and the crown. And you need to get dental implant. That will be the third one. And in some case that you lost all the teeth already, you might seeking for on-fold. On-fold is like all the treatment that we complete all the implant for the full jaw for you. And the last thing will be just really like for the general person that have, when we get older, the gum is the most important. So most of the patients will have the gum disease and need to get the gum treatment, bone graft to the gum.
And Dr. Pawak's my dentist, but I'm doing this video not to endorse him. It's not promotional. I'm not getting paid for this. It's simply to share with you the dental cost comparison between Thailand and the US, and we're adding a third price. That's for those who are seeking really kind of affordable care, maybe at the dental school. Yes. The number one most common treatment for guys over 50, for people over 50, women over 50.
Yes, all of them need to get at least one crown or the bridge in their mouth when you older than 50 because the tooth might be broken down or there may be some damage to the tooth.
We're going to talk a little bit more about what goes into the crown, but let's first start with the pricing. How much for the crown in a clinic, at Kitcha, or similar?
Actually, it depends on the material, but nowadays, most of the material that the dentists use around the world is the zirconium. So zirconium is really strong, white, look nice. The cost for the zirconium here is 18,000 Thai baht.
If you went to the dental school to save some money,
yes.
How much?
So over there will be the different payment policies. So the cost, the overall cost for the patient will be around 17,000. I'm saying that around because they did not have the exact price. Depends on the price that the lab will charge them.
But not much less than being at a clinic.
Not
professional clinic.
Not significant difference between here and over there.
And then in the US, we're going to pop that price up on the screen right now. So there's your 3 prices, but before we go on to the second most common treatment, Dr. Pawak, tell us a little bit more about the crown, what the patient should be aware of when they select a place to get the crown done.
Actually, most of the patients, if they need to travel across the world to be here, the thing is they need to have a good communication with the clinic when they will arrive, when they need to depart, because the crown is the thing that we need to plan about what is the day, what is the date of the delivery, what is the day that we need to do the preparation. So the communication is the keys that I think is more important to use, that you know before that there will be some place.
How long it might take. Right?
Yes. How long that you can be here and how many appointments that would involve, and is it fit with the dentist schedule or not?
I'll tell you a little story. Now, I make my base in Thailand, mostly in the south, Zirconia. It's a smaller town of only 130,000 people. When I sought out a crown treatment, I was in a kind of an emergency situation recently. We'll talk about it shortly, but I was looking for a crown in Zirconia. And they were telling me 2 or 3 weeks. And then, of course, here I got my crown done. It took about 4 days from the initial appointment to now I'll get the treatment. Yes. And then I did research Bangkok Hospital in Bangkok, where they could do a 1-day crown. Now, it was significantly more money.
Yes.
But I didn't need to, so.
Actually, we can do 1-day crown in some cases, but it's not for all the cases. Depends on the situation of the tooth, something like that. And the difference of the material is not the same, of course.
In the 1-day crown?
1-day crown. 1-day crown. It's not like morning, evening. Sometimes it can be done like that. But sometimes we need to have at least 24 hours to do all the works.
You say the material is different. Is the material better if you take more days?
Because normally the material need time to fabricating. So sometimes if we need to get it done faster, there will be some weak point in that.
Weak point?
Yes.
Okay, so in a way it's kind of better to do the 4-day version?
Depends on many factors, but the fastest that we could do will be around 2 to 3 days. Depends on the schedule also, and depends on the kind of the treatment and also the conditions of the patient.
Just to be clear, when we talk about the crown and you see those prices popped up on the screen, we're talking about a certain material. What's the material called?
The zirconium. Zirconium.
Zirconia, yes. Okay, Dr. Pawak, the second most common treatment for guys like me over 50.
Okay, most of the case need, before they get the crown, they need to get the root canal treatment. So that is a thing
I had
that
to go
you
do
have
that.
experience also, right?
Last month, so I had a root canal maybe 10 years ago when I was in Medellin, Colombia. Well, that tooth chose to act up when I was in Africa on a safari recently. I emailed you,
Yes.
Dr. Pawak, what am I was researching dentists where I was, Tanzania. In the entire country, they only have 100 dentists. And I stopped by one office when I was there, and I was like, no way am I going to go to a dentist here.
Oh,
So I sent Dr. Pawak an email, and we came up with a plan for the treatment.
yes.
So I flew back a little bit early, and I just had a root canal.
Yes. So everything is like really hard for you, right? When you're traveling.
Yeah, so I didn't want to get it done in Africa and in Tanzania. I didn't want to. I wanted to be in Thailand for that.
Yes. And also you have been researching in Doha also, right?
That's right. The first message I sent you,
Yes.
I was in Doha connecting the next day to
Tanzania.
Africa. Doha, it was a holiday, like a 4-day holiday, religious holiday. So no dentists were working. And also it was very challenging. They weren't responsive to me calling or reaching out.
Yes.
So I just said, I'm going to go for it. I went to the safari. That's right.
Yes. And then you need to have the tooth pain for almost a month before you can get the treatment done, right?
That's right.
Yes.
Yeah.
The thing is that is what I point out in the beginning, because most of the patient need to communicate before their arrival. So some office, some dentists might not familiar with the communication like that. So as to explain that, you have searching through many dentists or the treatment along the ways, but it's really hard for you to get it.
Yeah, it was, and I wanted to make sure that I felt comfortable and confident in the treatment I was getting. So for root canal, what is the pricing for root canal? Let's start with a private
Here, right?
clinic
Okay,
like
so
Kitcha.
the root canal treatment depends on the area of the tooth. Tooth in front will be start at 8,000 Thai baht, and the molar will be around 12 to 14,000 Thai baht. So that is the cost that you need to pay here.
So 8,000 if it's a more simple procedure.
The front tooth.
Front tooth.
Yes, more simple, more easier.
And if it's
Yes.
more complicated, a molar.
Yes.
So the window is like 8,000 to 12,000.
Yes, correct. That is the
8,000
cost.
about $240 for a front tooth. For the molar, about 360
I'm not sure.
or so. And okay, and then great. And then if a patient chose to go and try to save money and go to the dental school.
Yes, dental school is a little bit cheaper. The cost for the front tooth will be 6,000 and the molar will be around 11,000. So that is the
So
price.
6,000 to 11,000 or $180 to about $330.
Yes.
And now the price in the US, according to ADA guidelines and published pricing in the US. So those are the three prices for root canal. Anything else to consider about a root canal?
Actually, the root canal nowadays, there is a lot of complexity. That's why some place they might need to use the microscope to do the root canal to get it done properly, to see all the root that really narrow, very challenging. But some place they cannot equip with the microscope because the cost of the microscope is higher. So that is the thing that causing the difference between the treatment that done under the microscope or the treatment that has been done without the microscope.
And I can say that when I was coming back from Africa, you guided me. You said, listen, I know you're in pain. When you're in Bangkok, if you get the root canal done in Bangkok, we have to make sure that the dentist has a microscope.
Yes, that is the thing that I told you, because your root, the canal is really narrow and really challenging. So you need to get it done under the microscope.
And I think that's my tooth right behind us, where I had the Is this the third most common?
This is the third most common.
Implant?
This is a dental implant.
The third most
Yes.
common implant. I'm getting old, guys. You know, I never used to have these issues.
And
Back
you
to
cannot
back.
imagine, right, that
where-
you're going to have it.
No, you know, we think we're going to be young forever.
Yes. 3 years ago, you still have a lot of teeth in good shape, right?
Yeah, I came in and did the vlog with you kind of like a young guy 3 years ago. I didn't know anything about
Get the teeth cleaning.
back to back root
something like that.
canal. Yeah, teeth cleaning. And,
Yes, just normal procedure. But
Yeah.
once we getting older, the tooth will have some decay, some fragile things that cause the breakdown. So the treatment that most of the patient when we getting older, I say when we getting older because for me myself, I think I might have it done in 1 day in the future, but it should be the dental implant. Yes,
Okay,
because
so
you might
third
want the
most
tooth.
common is implant. Let's jump to the pricing really quick. How much for the implant in a private clinic like Kitcha?
Yes, so I need to explain like this because implant around the world is have a lot, plenty of brand like 100 brand, 200 brand, but not every brand that available around the world. So here we have many tier of the implant. We have normal implant that usually work well with all the patients, but it might not fit for some people. It's like normal implant will be 50,000 for implant and the zirconium crown. This means this price is like the package already. But if you come abroad, like from US or from Europe, I suggest to get the implant that more worldwide. So that is like just premium brand or the brand that more popular worldwide. So the cost will be 75,000 Thai baht for implant feature and the crown on top. The crown will be the zirconium.
And is that a separate price?
No, it's all included.
All
It's
included.
75,000 is
Okay.
included already. And right now, nowadays, many patients seeking for the implant that not made from metal. They don't want to have the titanium in their body because some reason they found that their body have the allergies to titanium. So now we have the zirconium implant that just launched into the market. So the cost of the zirconium implant will be 90,000 Thai baht for implant and the crown on top.
So that's going to be a little more expensive, but it's probably healthier long term.
Right now, the study they say that the zirconium is more tissue friendly, more biological friendly to soft tissue, to the gum, to the bone. So it's quite really good.
So for the implant, I had to get my implant, and I'm kind of a wimp when it comes to pain. So we did the extraction at the hospital. I was asleep. And then the next treatment was after the bone was stronger. I think I came back.
Yes, the reason that you need to make the bone because sometimes once after the extraction, if we wait it too long, the bone will shrink down. So once the bone shrink down, we need to add more bone to make the bone thicker and good enough to hold implant for you. That's why you need to get dental implant done simultaneously with bone grafting.
Yeah, and then the implant was quite comfortable. We did it right here at your office.
Yes.
You gave me a little bit of a gas
The
to
gas,
make
yes,
relax.
Yes. So implant actually is really minor surgery. It's really simple and straightforward. So I can say that dental implant treatment is more less trauma than extract the tooth.
So let's talk about not titanium, right?
Yes.
Let's talk about zirconium.
Zirconium implant.
The pricing at a clinic at Kitcha or like Kitcha is 90,000 baht.
90,000. Yes.
How much would it be at the dental school?
Right now it's not available.
Not available.
Yes.
Okay.
I think only a few places in Thailand have the zirconium implant available and can support to the patient.
Okay.
So not many places.
And then for the price in the US, we're going to flash that up on the screen right now. Zirconium implant in Thailand compared to the US and not available at the dental school right now. The fourth most common treatment for guys over 50.
They need to get the denture or like the full plate because they lost all the teeth already, right?
Denture?
Yes, full denture.
Am I going to have to do that one day?
No. If you can take care of your teeth very well.
Okay, I'm going to rely on you for this one.
Yes. So some of them need to wear the denture, but if they wear the denture already, they might don't like it.
Dr. Pawak, question for you, because sometimes it's so obvious when a guy has a dentures, right?
Yes.
It's almost like the teeth you would buy at the Halloween store. But they must have gotten better since then.
Yes, that's
More
why,
natural.
That's why nowadays in US there's a lot uprising treatment that many patients seeking for. They call the on-4. On-4 is like the.
Oh, you have the.
Yes, we have it here.
Can we
so
see?
You can see here. So it's like you need to wear the denture because you have no teeth at all, right? And then you wake up in one day and you feel that you don't want to take it out, put it on, and feel very uncomfortable during weekday for the function. So we place 4 implants into the jawbone. 4 implant, yes.
4 implants.
4 implant, just only 4 implant, and then we fix the denture on top of that 4 implant.
Oh.
So the patient will feel more natural because they don't need to take it out or put it on again, and the size of the denture will be smaller, thinner than normal denture. The conventional denture need to have the flange, need to have something that holding and supporting, but on 4 is mean we cut everything down.
Only top?
We can do upper and the lower. We can do both jaw.
Okay, and what is the cost?
The cost for on 4 per one jaw is 360,000.
360,000, so about $12,000 US.
Yes.
That's about $24,000 or about 720,000 baht
Yes, that is the upper and the lower for the full jaw.
for both.
For both.
Okay, that would be a complete mouth then?
Yes, correct.
Wow.
If they come in without any teeth at all. So
How often does that happen?
nowadays it's like every single month we need to.
Really?
Yes, we need
Is
to.
there anything a
perform
guy
this.
watching can do to prevent ending up with full
Yes,
dentures?
that is a thing that you need to do for preventing the loss of the tooth. So you need to see the gum dentist to get it clean, to treat the gum disease. That is a helpful treatment to prolong the oral health for you and keep the teeth intact for you.
How much for this at the dental school?
The on-4, right? They cannot do the on-4 in dental school because it's not like the mandatory treatment that
Now,
you need to do.
expat is not available to go to the public dental clinic. But if it's a Thai person, how much would it cost them if they went to their public hospital?
On-4 is not available also.
Also not available. That's why a lot of times when you're in the street, you see people with just no teeth.
Yes.
At least not all, but some.
Yes. Because it's like the most advanced treatment nowadays. So in the public sector, they need to focusing on something that more prevention for the teeth loss, but this is a more advanced for the replacement.
Okay, and lastly, the price in the US for the
On-4.
on-4 treatment.
Yes.
We're going to pop that up on the screen right now. Great. So the 5th most common procedure
Yes.
is what?
For the patient that above 55, right? So everyone need to get the maintenance for oral health. So some of them might have the pocket, might have the gum inflammation, might have the bleeding, might have the infection. So the gum treatment, disease is the most common.
So that's like a graft?
Sometimes just really like maintenance to do the cleaning, to do the deep cleaning.
deep cleaning.
Yes, deep cleaning. But some of them, if there's some loss of the bone and in the right situation, we can regenerate the bone and the gum.
You know, I once had to do gum graft, but it's not fair. I feel cheated. I'll tell you why. Because when I was a young boy, I would go to the dentist in Napa, California, and he would give me the most toughest toothbrush, firm, and he would teach me, scrub your gums. Scrub hard, make them bleed. They would used to tell us.
I see.
You know, and
So and it caused the gum
So
recession.
the dentists back in the day would tell us as kids, scrub them till they bleed.
I see.
You know?
So it's hurt your gum.
Yeah, it actually made it recede.
Your recession, and
Yeah.
then you need to get the gum surgery to gain
That's
and
right.
augment the gum to make the gum stronger.
Yeah.
If you have the strong gum, you can have the strong
I
teeth.
think his name was Dr. Fenderson, if I remember. Obviously, he's not around anymore, but that guy, you know?
Okay. It sometimes it's like depends on the age of the patient also.
Yeah.
So they cannot teach young kids to do the right way. So the most easiest way is just really scrub it.
Now they just say soft, use a soft brush.
Yes, soft brush.
Gentle, sonic care. And
That
then
is
you
what I
told
told
me sonic care is not enough. You actually need to do a manual brush too.
Yes, correct.
I didn't know that.
Yes, because sometimes it makes your life easier, but it's not the thing that the better situation.
So pricing for gum treatment, what are the different pricing?
The cost of the gum treatment depends on the procedure. So the gum treatment is like the whole universe of the gum, right? So if we do just really like maintenance, the cost of the maintenance every 3 to 4 months or 6 months should be around 1,000 to 2,000 Thai baht. That is for the maintenance.
Only
So
$30
it's-
to $60.
Yes, it's really cheap. But once you have the more severe condition, like you need to do graft, you need to do some surgery, deep cleaning, the cost can be up to 6,000 to 10,000 for one
Okay,
procedure.
so anywhere from $180 to $300 for graft.
For deep cleaning,
Deep
for
cleaning.
the full mouth, until if we need to do grafting or the open surgery.
And
So
how much for graft?
the graft will be depends on the material that we need to add. So I can roughly say that it should be around 10,000 to 20,000.
Okay.
All include with the material and also the doctor fees.
How does that compare to the dental school? How much for the graft?
Actually, because the graft, most of the time, the cost is for the material that need to be used in the patient, right? So the cost of the procedure, the cost of the graft material is all the same. Just only the cost of the procedure is a little bit slightly different. So if you go to dental school, the cost of the surgery will be around 6,000. Here we start at 9,000.
Okay, so, and now let's flash up on the screen the cost for deep cleaning in the United States. Okay, there's one other bonus, I think, treatment we could mention. With you said tourists sometimes come and they just want to get teeth whitening.
Yes, correct. The cost of the teeth whitening here is 9,000 for the zoom whitening. But we also have another type of the whitening, like the home whitening, will be starting from 4,500, and to the zoom whitening that will be 9,000.
So you can go home and do a whitening for $4,500,
Yes.
or about $140, or you could get the treatment here
Yes.
in the clinic, Zoom, 7,000,
9,000.
9,000,
Yes.
or about $270.
Correct.
How much would that cost at the dental school?
Dental school is around 9,000 Thai
About
baht
the same.
also. Yes, because the most of the cost is the cost of the material.
Okay, and right now we're going to flash on the screen dental tooth whitening Zoom in the US, and also your at-home treatment. So there's your 3 prices. But let's get beyond
I need
price.
to add this because in US, you guys have a lot of over-the-counter products, right, for the
Oh,
whitening.
sure.
So here it's not as same as over-the-counter because you need to make the custom fabricating tray that fit for the patient. So you don't need to have the risk or the chance that you can get burn or some discomfort during the treatment.
So there's an option in the US to have the over-the-counter.
Yes. So we cannot compare with over-the-counter
Okay.
products over there.
Let's talk about, we're talking about pricing in this video,
Yes.
but there's a related, what could be an expense or a value based on the kind of treatment you're getting. I think you see ads around Thailand for cheap dental.
Yes.
What should people be aware of when they are considering the cheapest advertisement?
I think here in Thailand, the dentists here have the license, they have the standard that we graduate from the dental school, right? But sometimes it's like the cost of the treatment might be not the same. Depends on how they set up the venues or their office. The cost of the material that they use, because the quality of the material is might be not from the same source. So here we use the material that mostly common in US already. It's like from 3Ms, from curves that as same as in US. And also the dental implant, as I said, because now around the world have plenty of brand of the dental implant. But if you get the cheapest cost, sometimes if that brand is not available for you in next 5 years, 10 years, maybe causing more problem for you, that you need to get the dental implant out and replace a new one. So that is a thing that you need to consider.
Dr. Pawak, every time I come to see you, In the reception area, there's always a lot of foreigners, a lot of expats. It seems like a lot of your patients are expats.
Not all, but it's like around 40% of the patients will be foreigner. I could not say that is they are tourists or the expat, but the reason that we have because we can communicate really well in like Thai and in English, and also we still have like some Chinese person to communicate with the patient because we believe that communication is the thing that is really precious.
Communication.
Yes.
Yeah, and I'll say this, one reason I like to go to healthcare or dental in Thailand compared to the US is the communication. For example, you reply to my emails, sometimes the doctor will provide WhatsApp, and there's just a more of a personal feeling, whereas in America, there's a big barrier between the patient and healthcare where you just feel like the medical staff feels like they're on a pedestal, and it makes the patient I feel less human. But that's another topic. Dr. Pawak, do you have any dental tourism? Do people actually come here to get treatment?
Yes. As I said before, it's like we have a lot of foreigners here. So part of them is just really come here fly from US to be here just really 1 week to get the treatment done, and then they go back. It's like for the dental implant, we cannot finish in 1 day or 2 days as you have the experience. We need to have the time for your body to be healed and integration to make everything right. So patients still need to be here 2 times. So once they need to be here, they need to communicate with us about when they could arrive. So that's really important.
You know, I'll say, and I do come into, I guess I'm like a dental tourism because I do not live in Chiang Mai. When I come here for a treatment, sometimes like this trip, I have to do the crown and the crown for the implant. So I'm here for 5 days, but you know, being in Chiang Mai for 5 days isn't the worst thing. There's so many hotels to choose from. You get a very nice hotel for not very expensive. There's all this food to enjoy while your mouth maybe not numb. And then you have just Chiang Mai vibes of the coffee shops. You go to Niman, you can go up to the temples. So you can kind of combine a nice tourist experience with your dental treatment.
I think that is a good point because here in Chiang Mai, we don't have the beach and sand and the sun, right? Not like same as in Phuket or Pattaya. But we also have the good vibe, like Chiang Mai vibe, that it's not, you cannot
the vibe.
Yes, you cannot fight.
You have these like nice evening lounges with really amazing food.
You can walk around the old cities and listen to the
around
jazz
the old
music,
city.
something like that.
Yeah, you can go visit the monks. And I'll say this, another bonus for me, when I come to Chiang Mai, I love the convenience of the airport.
I see.
It's so close to the city and there's no traffic. For example, if you fly to Phuket or Bangkok, that's going to be another hour and a half on.
The cost of the expense is much lower here also.
That's right.
And our airport, even it's small, but it have the direct flight from many countries around the world. If you can fly from US through Incheon to Doha, so you can be here.
Yeah. So, Dr. Pawak, anything else that we should add to this video before we say farewell?
I think here we focusing on the service for the patient around the world. So as you can see on our website, there is the direct phone number for the patient in US. So we have the direct phone number in US. So you guys, if you have any problem in US, you can call us directly and it will ring on our desk directly.
Yeah, and for this topic, if you go to the description to this video, you'll find a link there. If you click on that link, you'll find all of Dr. Pawak's info. You'll also find a link to the Borderless office, all my other vlogs and blogs and everything else. But Dr. Pawak, thank you.
Very nice to see you. Glad to see you.
I do want to mention one thing. For example, here we are speaking English. You spend a lot of time in the US.
Yes.
I think you were in Portland.
I was in Los Angeles and also in Portland.
Right, so your training was in the US?
Yes. Nowadays, most of the dentists here at our clinic is US trained.
Yeah, so, yeah, and I think when people are watching from the US right now, maybe a footnote to all this is they get U.S. trained dentists,
Yes.
and even the Thai trained dentists are so good.
Yes, because it's like we believe that we need to improve every years by years for the Thai dental communities. That's why some of the dental professors, they graduate from US and they
Yeah.
train the same as they was trained in US here.